Today, scientists at the Food and Drug Administration and World Health Organization are arguing that booster shots may not be needed for the general population. It's a conflicting message within the Biden administration. And ABC 7 News reporter Stephanie Sierra is digging into the implications. She's in the newsroom taking a closer look at the mixed messaging. And I suppose, Steph, we shouldn't be surprised. Almost from the start, there's been mixed messaging since this pandemic began.
Right, Dan. It certainly creates confusion when the FDA and the WHO are both at odds with the White House. And doctors are concerned this mixed messaging will make people more skeptical when to get another dose and even further delay the rollout.
The COVID-19 booster shot controversy continues as the White House battles mixed messaging with the Food and Drug Administration and the World Health Organization.
I would wish that the federal government could speak with one voice.
A review published in a top medical journal, The Lancet, argues there isn't enough data to warrant booster shots are needed for the general vaccinated population, citing the vaccine's current efficacy is still high enough to prevent severe disease and death. The report has 18 co-authors, including 2 high-level FDA officials, who have since resigned over the controversy.
This is one of these questions about the perfect is the enemy of the good. And these guys want perfection. And I think you'll probably have to make the decision on less than perfect data.
UCSF lead epidemiologist Dr. George Rutherford says he's concerned the mixed messaging will result in added confusion and vaccine hesitancy.
I mean, clearly it'll make people it'll create dissonance for people, cognitive dissonance for people who are planning on getting a third dose about what should the timing be and whether they should really get it or not.
Most of the authors in this report are from overseas, including experts from the WHO that are calling for a COVID booster moratorium until 2022. Stanford infectious disease physician Dr. Jorge Salinas agrees.
While at a personal level there may be a slight benefit of a third dose, there is a tremendous benefit if that dose goes to somebody else who has not been vaccinated.
As far as what happens next, the FDA's advisory committee will meet this Friday to review Pfizer's COVID-19 booster shot data. The CDC will then make the final recommendation.
Do we not do this because studies are imperfect? I think you have to act on the data you have and make hard decisions based on what's in front of you.
Now, the report does acknowledge booster shots may eventually be necessary for the general population if immunity continues to wane even further or another infectious variant emerges. Again, we'll know more after the FDA's advisory committee meeting this Friday. In the newsroom, Stephanie Sierra, ABC 7 News.